Hi.
Hi.
Let's see.
Let's see, we got a few people here in the audience. Hello.
Hi.
So I am, for those of you who don't know me, I'm Pauline Walfisch. I'm one of the social workers that help enhance psychotherapy. I'm an EMDR provider and consultant, and I'm super excited to have Gina Colelli here with us today. Gina is the beautiful soul that trained me in 2019 in EMDR and really changed my life and practice in all sorts of meaningful ways, and is coming back to do our EMDR training in the fall. So Gina and I have been talking about, like, how do we tell people how awesome EMDR is, and how great it is to get EMDR as a therapy, but also for the providers who are out there and listening, how meaningful it is in the therapy room, and how much power it gives you to be able to really help people heal in ways that traditional talk therapy doesn't always do, or takes much longer to do. So this is Gina, and we are coming to you live on Instagram. So Gina, I'm going to start with a couple questions
Sure.
that, like, therapists have asked me.
Okay.
One of the biggest question that I get all the time is, like, I'm not a trauma therapist. I don't treat a lot of trauma. Like, how would I use EMDR if I learned it? It's super expensive, time-consuming training. Like, how would it be useful if I don't treat trauma in my practice?
Right. Most therapists treat the issues of anxiety, depression, everyday problems, issues of self-esteem, fears of abandonment, that sort of thing. And what's really great about EMDR is that even though originally it was used with PTSD or acute stress disorder, we rapidly discovered that it was applicable to the issues that I just brought up. So most people come to therapy usually because, like Freud said, love and work, one or the other, and usually around issues of relationships, whether at love and work, and also maybe chronic underlying conditions of anxiety and depression. So EMDR is very applicable to those things. Whether we're working in the present, where someone comes in and says, I don't get along with my boss, or I'm challenged by that issue, and what can EMDR do for me? Well, it could reprocess, what we call reprocess, like desensitize and reprocess the fears that people have around working with, say, a difficult person, or what they perceive as a difficult person. Because often what happens is that people realize that it's an internal issue on their part, usually from some earlier relationship, and we clear that also. That's what we call it in EMDR. We clear. What we mean by that is that the repeated patterns are stuck in a loop, and we interrupt that loop and desensitize it, and then allow what's inherent and intrinsic to every person is an adaptive way of handling conflict or stressful situations, because it's
Sure.
already in us. I mean, sometimes we have practicals, like we'll teach people practice of communicating or conflict resolution skills, anger management, that sort of thing. But it's inherent and intrinsic to us to have the capacity to do that. And what we're doing is freeing up any blockages from that capacity.
Yeah. Sometimes clients will say to me, like, but like, there really is this terrible thing happening. Like,
Right.
I didn't make it up. It's not, I don't have any
Sure.
childhood trauma. Like, there's no ghosts in my
Right.
closet. Like, yes, the
Right.
world is really on fire, and I'm, like, worried, and I can't stop thinking about it. Like, is that something that EMDR would help with?
Absolutely, because fear, there's two kinds of fear, right? Like there's fear where, like, high alert, like I'm in danger, and then there's the lingering fear associated with that, even when the danger is over. And people could say, you know, like my life is fine in the day-to-dayness of my life, but still be worried, whether it's about your financial future or any other circumstances, your parents getting older, your children starting school or whatever. All of those things are kind of like natural to have concerns about, but often what happens is that we build up on those things and they kind of, it's like the train leaves the station and we don't know how it got 3 stops down without us noticing we were on a high-speed bullet train. That's kind of what worry, doubt, and fear does to us, right? So what we're doing is we're increasing people's capacity to handle everyday life situations so that they do feel centered and grounded and know how to respond or what to do if there is, in
Yeah.
fact, whether it's
Sometimes
a psychological danger or actual physical danger,
yeah,
right?
EMDR like takes the heat out of
Right.
the thing that's sort of smoldering, right? Like,
Exactly. It's just like if you have say you have a chronic condition, for instance, say you have a learning disability or you have, you know, a chronic pattern response to something. There's emotions affiliated with that condition, whether you say you're going through medical treatment for a disease, like there's that, and then there's all the emotional stuff attached to it. And what EMDR does is clear the fear, doubt, and worry about it. So first of all, it's a real support to your immune system if that's the case. Or you get, like I've worked with a lot of college students who have learning disabilities and they go to college and they're with a bunch of other really smart kids and they get overwhelmed, as students who first start college usually do, but they have this added thing, right? This learning disability. When I clear the emotional stuff connected with, I have a learning disability and now I have 3 times as much homework as I did in high school, then they're like, oh, okay, this is how I handle it. Like, this is a big issue
yeah.
because the emotional stuff got cleared from it. So that's what, I'm sorry, Siri thinks I'm talking to her. Uh, I'm
Well,
sorry.
we are live. Maybe Siri's out there.
Yeah.
Hi, Siri.
No. All right. Hi,
Um,
Siri. So it's the emotional stuff connected to real life situations that help people make better choices. So EMDR is always about safety, responsibility, and choice. So when we're clearing issues of responsibility, when we move into issues of choice, people have much better capacity to make a wise decision from a neutral place versus a reactive place.
yeah, yeah. And I think that was like very helpful to me. Like, so for people who are thinking about doing the EMDR training, in the training you get to practice on a real life issue. So as the
Mhm.
learner, right? So if you sign up for our training, half of the training is actually practicing EMDR, and we practice on each other. So Gina and I would take turns. I would be the therapist, she would be the patient if we were students in the class,
Mhm.
right? And sometimes she would be the patient and I would be the therapist. If I said that backwards, you all are following, right? We take turns. So in my training back in 2019, when I got to bring an issue that I was working on, right, it had to do with a relationship with my teenager at that point. And if there's any teenage moms out there, like lots of challenges that it was bringing up for me. And so I got to like work on a current issue, like a recent argument that we had had, and sort of unpack all of the feelings and fears and worries that I was having about that conflict. You know, like, what does this mean about me? Am I a good mom? Am I a good person? Am I a good therapist if I'm arguing with my teenager, right? And so I got to, in that EMDR therapy, like as a just as a learner with a therapist who was learning it for the first time, like really changed how I looked at it. And I was able to kind of step outside and be like, oh, okay, wait a minute, like this is what it's like to have a teenager. Like this is not
Mhm.
me. you know, this and all the other stuff that sort of unfolds and unpacks. And the issue wasn't a trauma related issue that I was coming with. It was really like a present day, right? And because I'm a therapist and because we understand like there's some fuel in the gas tank of probably like other times in my life there where I worried I wasn't doing the right thing or I wouldn't be good enough, right? It brings up all of that stuff. And we all have that, whether we have trauma or not, right? We've been through life and we develop. So, yeah, I mean, I think it's such a good therapy, not just for trauma. So
No,
I'm always
it's,
telling people,
yeah. And also, if you look at the EMDR literature, we see that EMDR is good for performance enhancement. Like I said, chronic conditions that we're grappling with,
yeah,
grief, right? People will come in and say, the grief is a natural, normal occurrence, but grief sometimes becomes disabling for people or just overwhelming. And so often therapists will say to me, how long do I wait? Because grief is a normal process, right? Well, I don't think that people need to suffer in their grief. And that's the other thing about EMDR. It doesn't take anything away that's inherent and natural. Like you said, you came away with, oh, yeah, this is what it's like to be living with a teenager. My reactions are not unique. However, right, so it's not going to take away this kid annoys me when they do
right. It
XYZ,
doesn't
right? Like,
make things that are true not true.
correct. It doesn't make things that are true not true, but it allows you to pause and come from a place of choice, which I think is, very powerful. Being able to clear away things that interfere, that are reactive. Like I'm reactive. I know I'm being reactive, as opposed to I'm making a measured decision, even a spontaneous decision, but it's measured, it's coming from a place of feeling centered and grounded, as opposed to a reactive place. I mean, who hasn't? I can't imagine anyone saying, oh, I've never reacted in a way that I look back and said, who was that person? What's that? Where did that come from? I can't believe I had that reaction. Right. So that's what I'm saying. That those are the things that people often do come to therapy for. Right.
Yeah, yeah,
And you mentioned something before about, talk therapy. Talk therapy is a wonderful thing because talk therapy, we need to be heard, right? We need to be acknowledged and we need to be heard. But one of the things about EMDR, what it addresses that takes many years in talk therapy to achieve these results and doesn't retrieve them in the same way, is these pattern responses that literally get locked in a neural network in the brain. So people will often come to me after like great therapy with great therapists and say, I'm still stuck in this way, right? Like I know this, that, and I know it front, backwards, sides, up, down, inside out, but I'm still that same response and I can't get past it. And it truly interferes with people's relationships. That sort of thing is great for
and
people.
their own
Right.
happiness,
Yeah.
right? Not just
Oh, yeah.
relationships, but their relationship with themselves.
Right. Right. It really interferes with their sense of well-being and self-esteem. So there's the shame that comes along with it, the sense of powerlessness. I'll always be this way. I'm not fit for human consumption. That's what I say. I'm not ready for prime time. And the EMDR is great with that. I've worked with many people who come in with exactly that issue and clear this pattern response, and they're freed up. And that's really beautiful. That's really beautiful because you're really giving people their lives back.
Yeah. And every time I see it, or every time, one of my colleagues talks about an experience they had where they got to watch somebody really clear this thing that has
Mm-hmm.
been weighing on them for years, it's like I still get goosebumps. Like it's just, it's so cool to watch. Like it really is amazing when that happens for people, and it's such a privilege to be able to do that and be a part of that experience. And I tell them all the time, like, it's not me doing it, like it's your system. Your system's doing the healing. i'm
Right.
just I'm just helping it along. Like
Exactly.
you're doing the work.
It's the same analogy to if you cut your hand intrinsically knows how to, the skin knows how to repair itself. If there's an infection there that blocks that healing, natural, inherent, intrinsic healing process, we clear it, right? We clear the infection. That's exactly what we're doing in the nervous system. We're clearing the blockages, the infection, so that the system could do what it's set up to do. You know, people will ask me, can someone's system be so damaged that it can't repair? You know, the answer to that is if someone's totally blown their system, say with drugs like crystal meth or something, we've got a challenge in front of us. But even then, there's repair that could go on because the system is always looking towards a state of health. It's always moving towards a state of health. Even if we have a lot of negative thinking, the negative thinking is really trying to get us to a state of health. It's just doing it from a negative place, right? Like people say, I don't want to do that anymore. What would you rather be doing? What do you want to be doing instead? That's the positive way of thinking about it. And often people have never had the opportunity or even thought about, yeah, I could have a positive belief about myself in this situation.
Yeah. And
right.
It
So
certainly doesn't come naturally, right? They've had years and
right,
years sometimes of like repeating those negative thoughts. Like I tell
right.
people, like if you think about like the lawn where you're here, we're here in Long Island, right?
Mm-hmm.
So if the mailman or woman or person walks across the lawn every single day, it sort of makes a path in the lawn. And so when visitors come, they think, without even thinking, that's where I walk,
Right.
right? They just go on the part that's worn out. And our system's the same, right? We develop these like internal pathways back to that negative thought or feeling or memory. And EMDR helps people to clear that and develop new pathways so that you can not always go right back to all the negative beliefs, and you can learn and integrate these positive
Mm-hmm.
beliefs.
Absolutely. That's a really great way of describing it. I think, though, it's a challenge for people to imagine that. You know, they can't, like, how do you do that? But if you look, there's actually SPECT scans. That's a high resolution brain scan. You could Google SPECT scans, EMDR. Daniel Amen is one of the researchers who did a lot of work with that. And he shows pre and post SPECT scans
So
after people getting
fascinating.
EMDR. Pagini in Italy did pre and post EKGs, and he's a pure researcher. He's not a clinician. He said it astounded him, the results that he got.
Yeah, yeah.
He said
I've had I've had
yep, let's
clients who
go.
have smart watches
Right.
who are uh like my pulse drops 10 points, or they're
Right.
using their watches to track the quality of their sleep, and then after
Mhm.
EMDR they come back, they're like, I never got a gold crown before, and like I've gotten a gold crown in sleep for the past 3
That's
nights. Like
right.
it's just, you
Right.
really can
Yeah.
see some of the shifts.
Right. As clinicians, part of the history taking is setting goals. And the question is what would your life look like if EMDR worked for you? Right. So that's part of, like, it could be like improved sleep, better relations, less reactivity, more positive feelings, feeling more self-confident, doing things on my own, taking up a hobby, you know, things that people say they want to do but don't for, you know, a variety of reasons. And they all go on the goal list so that, well, as you're doing the work, you're checking to see, are we reaching our goals?
Yeah.
Right? And it's very reinforcing and empowering for people to, and often, again, this idea of thinking about treatment as something positive, not just I'm not going to feel bad, but I'm also going to do, this is what my life would look like, right?
Yeah.
Yeah. So it's very, very positive.
Yeah. So another big question that comes up is like, I'm a virtual therapist. I'm not in the office. I only see clients virtually. Like, how would I do EMDR virtually with people?
Yeah, it was fortunate for me that I was actually doing virtual treatment 10 years before COVID, because I had some clients who traveled a lot and they wanted to continue their treatment. It hadn't occurred to me, and I did it because they asked me. I said, okay, I'll try it. Let's see what happens. And to my happiness and their happiness, I found that there was no clinical difference. Some people prefer to be seen in person, but there was no clinical difference between me treating them online or. So that's part of the training too, where we teach you how to do EMD, how to do a history, and how to do EMDR online. And there's many ways. It's really, I'm kind of babbling here, only because there isn't a difference between in person and not, except for some technical things. Like in person, I might tap someone. Online, either they have tappers or they're doing self-tapping. The results are the same.
Yeah. Yeah.
Mm-hmm. Yeah.
I mean, because I'm in the office a couple days, I prefer to be in the office. But I have tons of clients that currently do EMDR with virtually, and they have the same effect.
Right. People are free to come and see me, and they say, I hope you don't mind. It takes them an hour to get to me. They're with me for an hour and then an hour back. It's like it's like they have lives and families and et cetera. And they're like, my practice is in Manhattan and they're in Brooklyn or New Jersey or wherever. Same thing, right? Like
I'm in Long Island. I have people who take the train from the city to come see me.
Right.
Or, travel different.
Right.
Right.
Or they don't want to. Right.
It's
yeah.
personal. Yeah. It is preference. And there's the relationship. EMDR doesn't take that away. Like the relationship in the therapy room is so important, whether you're doing EMDR or DBT or ACT or any other kind of therapy. So if it's important to that person that they're in the room with you, then they're in the room.
Right. Right. Mm-hmm.
So, yeah. All right. Well, if any of the people who are out there have questions, like I think if you put them in the comments, we can see them. But those are some of the big questions that we get asked. And this training is going to be in the fall. It's going to be in Farmingdale, which is sort of the middle-ish of Long Island. It is a live in-person training. Gina is the trainer. And then she has a wonderful group of EMDR consultants with her who will be facilitating and helping you in the practicum. The training, I guess we can talk a couple minutes about what the training structure looks like. So most people have not been to a training where there's so much practicing. It's usually lectures and instruction. So how does that work? The
way we design the training, first of all, the training is standardized around the world. In other words, if you take a training with me or training with a trainer in another area, you're getting the basically same training, the core, the training.
If you go to an EMDRIA approved training.
Correct. If you're going to, you have to know it's an EMDRIA approved, and EMDRIA approves trainers as trainers, right? So, and we go through a rigorous process to be certified as a trainer. But so the training is comprised of 20 hours of lecture, 20 hours of practice, and 10 hours of consultation. The lecture part is a combination of standardized didactic presentation. There's pre-learning asynchronistic videos that are short videos describing some pretty important things that you need to look at before you come, but it saves time in the training, so I could use more time for things like doing demonstrations. So everything I'm teaching, you're going to see me do, all right? And then you also, the participants have ample opportunity to ask questions and clarify any concerns they have or confusion about what I'm teaching. So I like to balance things between doing demo, didactic, and also teaching and using live many of the grounding skills and preparation skills that we do with clients to get them ready to do the EMDR work. It's phase 2. It's part of EMDR before we start doing the desensitization, which is phase 4. But so I teach all of that during, and we get to do them. So if I do a mindfulness meditation, we get to do that. If I'm doing the 4 elements, self-talk, tapping, all of those things, people get to actually experience them in the training, which makes for, I don't know about other people, but I was always the kid whose foot was going up and down in school. I'm not an easy sit and listen kind of learner. So I integrate in the didactic that we're doing these kind of exercises, helps people, giving frequent breaks, doing demos so they get to watch everything that I'm teaching. I do a couple of demos on a full session of EMDR. And then afternoons, it's all practicum. We do a short lecture after lunch, and then it's practicum. Because after lunch, people start to get a little sleepy. So yeah. we practice in the afternoons, which is really great. So they get to practice all phases of EMDR. They get to be a therapist. They get to be a client. They get to be an observer. And they get to do that a number of different times. So that when you're completed the training, you're going to walk into your office and use it with your clients. Right? And in between trainings, we have consultation where you get to present an individual client. Right. And then after the training is completed, we have another 5 hours of consultation. Usually, or it doesn't have to be, you could continue the client you started with, right? Like 3, 4, or 5 sessions later and present them again or present a new client. Yeah. And then of
consultation
course,
is so important in really helping to integrate everything that you learned and gain that confidence. Like that was such a crucial part of the training that those 10 hours are included.
Absolutely. And then you have the choice to continue that, which most people do, because if you really want to use EMDR and integrate it, you're going to want consultation, whether it's individual or in a group.
Yeah. Now, 5 years later, I'm still doing consultation, and I learn something new every week. So it's great.
Oh, that's great. So again, just one other piece of this, which makes it unique, I think a unique training, even though I'm doing the didactic piece and the demos, the practicum, the practice part, you get to do it with different consultants or what we call facilitators. They're all EMDRI approved consultants or in training to be a consultant. But you get the experience of a number of different people, which also allows you to choose who you'd like to do your consulting with during the training and after the training. You're free to choose who you'd like to continue studying with. So that's another wonderful thing, because people, like you always talk about, it's nice to give people choices. They get to choose who they feel, in alignment with. And that's the other thing. So we're all available after the training for consultation.
Yeah. And again, right, it goes back to the relationship, and then also like skill set, right? I know like Zoe, who's part of your training team, like is an expert in working with dissociation. Like that is, if you are also an expert in working with dissociation and you're learning EMDR, like you maybe want a consultant who like has been living that life. A perinatal consultant, somebody who works with the Orthodox population, like LGBTQ consultants. Like there are so many different options.
Right, there's so many options, right.
People who have different experiences. So
right, people who specialize in the loss of children, you know, through death and accident, you know, people who specialize in adults who were sexually abused as children, or high functioning adults with relationship problems, right? So, yeah, people have their specialties, and so you get to learn about that in the training, about what people specialize in.
Yeah.
But most important is that they're all expert in EMDR.
Yeah.
Right.
And you have been teaching EMDR for how long, Gina?
Over
Sorry if
25.
I'm going to embarrass you right now.
Over 25 years. Right.
And she's only 29.
I'm only 29. When it was 1993, just a few years after I was born, I got trained in EMDR. And
yeah.
But I've been a psychodynamically trained therapist for 10 years when I got trained in EMDR and decided to integrate the psychodynamic treatment and EMDR together for long-term treatment. So I specialized in providing long-term treatment from a psychodynamic perspective and integrated EMDR for all of those issues that come up around in long-term treatment. So yeah. But thanks for the compliment.
Anytime. You are a wonderful trainer.
Thanks.
I had the privilege of training with you, and it really inspired me to continue to be an EMDR therapist.
Thanks.
And gave me the confidence that I needed, because not everybody who gets trained in EMDR goes on to continue practicing EMDR, because it takes commitment and skill and
well,
a
sure.
wonderful
It's like
teacher.
if you go into an analytic institute, or you're studying somatic therapy or cognitive behavioral therapy, you know, those are multiple years training, right? So even though EMDR is a 50-hour training, it's a methodology like those other methodologies, and it needs continued study and supervision for you to really integrate it.
Yeah.
And really utilize it. So I'm very glad for the questions, particularly around can we use EMDR with common everyday therapy issues, and absolutely, without a doubt.
Yeah.
Right. So, and I just want to pitch that's really great for PTSD, acute stress disorder, right, and childhood trauma. It's really good for it. So.
Yeah. Yes. It is a great option. So if people are out there and thinking about getting it yourself, definitely try it. And if you're a therapist who's thinking about like what kind of tools do you want to add to your toolbox, like EMDR is such a useful and versatile tool that I can use it with just about anybody who comes into my office, and really makes such a difference. So Gina, thank you for taking the time to be on Instagram Live with us today. We did it.
Yay. My virgin voyage into Instagram, live Instagram interviews.
So I'm so honored that you get to do that with me. I will, this will get recorded and we'll be able to post it later for anybody who missed it live. So
terrific.
If you missed it live and you're watching us on replay, comment below. I think that's what I'm supposed to say. And maybe we will see you in the fall training.
Terrific.
So have a great day, Gina.
Thank you, Pauline. Thanks again. Thanks,
Bye,
everybody.
Instagram world.
Bye.